I know you will, Tracy.
Here, Darren Andrews, the clinical director of PAI Medical Group, and Nick Hanna, he's a client. You and I we were just discussing the fact that the leaves haven't fallen off trees yet. Sort of an appropriate metaphor for what we're about to talk about. We saw you guys. This is the after, right? So I think if we can take a look at Darren's before, do we have that? Okay, it's going to be up in a second. But you started out as a client.
I did.
How do you go from the client to the director? There we go.
So there I go. So I had mine 11 years ago. It'll be 11 years in November, and I had a sort of a thinning right through the top of the scalp. So, you know, I went along and originally went in there looking to just get my hair back, and it kind of became a passion of mine and something that obviously has become a career, and you know, I'm involved obviously heavily with the business.
Sure,
and it's something I'm very passionate about.
Well, Nick, what made you decide that this was something that you were going to at least research and then go through with?
Well, yeah, I started losing my hair when I was about 21 years old, and that's a really young age to start losing your hair. And so I joked a lot about it.
Sure. Yeah.
Tried to make light of it, but really deep down inside, I was pretty self-conscious about the way I looked.
Impacts your confidence, right?
Oh, terribly impacted my confidence. And so I decided to take a look. Yeah, you can see it's pretty different. I gave Darren a call and decided to move forward with it, and really pleased with the results.
Now, absolutely. Now, there are a couple different approaches to this. I know this because you and I have talked before, and full disclosure, you and I have talked professionally. I visited the clinic. So he is the multi-unit grafting?
Yeah, we did multi-unit hair grafting with Nick. We do the ARTIS robotic FUE as well, but for Nick's needs, with the amount of coverage that he needed, he was most suited to the multi-unit hair grafting. And I had his procedure about 2.5, 3 years ago, and he's done really great. And you know, we started his hairline, rebuilt the hairline, just worked back, and went evenly through the hair he already had on top.
Okay, how was the procedure for you then?
Oh, it was incredibly easy. There was zero pain, and it was just great. I mean, they took care of me. You know, I work in the medical field, so I kind of knew what to expect.
Okay.
But it was even easier than what I would have ever anticipated.
Okay, so let's talk about the hair grafting then, as far as the procedure and what's needed.
So the hair on the back is genetically permanent. So when you take the hair from the back and move it to the top, it maintains that permanency, so you're never going to lose that hair. The procedure takes about 5 hours, outpatient procedure done at the Pyramid Buildings here in Indy. And it's done through different phases. This particular guy, Justin, this was actually the robotic procedure where we use the ARTIS robot. It's guided by the physician. The lines on the left-hand side are his hairline before the procedure marked out by the physician. Right. So the robot goes in, actually identifies follicles in the back of the scalp and uses digital imaging and mapping. Wow. And we can extract the follicles individually, then move them to the top. And the key with this is just the accuracy. It's 1,000 times more accurate than the human hand. So, you know, the variables of doing that particular type of procedure by hand are taken away because of the accuracy of the robot. It's just incredible. We're the only place in Indiana that has the robot, and it's an amazing procedure. A different approach than what Nick had, because of the requirements being different.
Sure, right. Each client is different.
Exactly.
And there are also some things that can be done to maximize the results.
Right. So one of the things, and Nick was an example of this, I mean, there's a sort of a double-barreled approach to hair restoration. Put back what you've lost, keep what you've got. Right. So we use stem cell treatment known as platelet-rich plasma now. We're using plasma from your own blood, laser hair therapy, and there are a couple of other modalities, and they're the primary medical things that are medically proven to help keep the hair that's already up there. Different from the transplanted hair because that's permanent, so you combine the two of them.
And you're obviously, I don't want to say obviously, but the fact that you're here willing to speak of it tells me that you're pretty happy with your results.
Oh my gosh, I couldn't be happier. The confidence is certainly through the roof, both professionally and personally. Sure. And it's you know, I'm willing to, I've told Darren numerous times, I'm willing to go and talk anywhere he wants. Put me on billboards, I don't care. Okay.
I've done that.
That's actually happened. But you know, I wake up every morning, and you look at yourself in the mirror, and it's just, it's even 2.5, 3 years later, I'm still enamored.
Terrific. Well, that's great to hear. Also, some people that like to be on billboards. Gunner and JMV, they've been pretty pronounced about the results with them, too,
a little competition going on there with those guys. So JMV is coming up 8 months post-transplant, and there's videos on his VIP page. So if you go to wegrowhereindy.com, go to the top and you'll see VIP, click on that, and we're tracking Gunner and JMV through that process with videos, the procedures on there, really educational. So it's that's a lot of fun. Those guys are doing great.
Awesome. WeGrowHairIndy.com, right?
Yep.
Thanks for sharing your story, Nick.
Thank
Good to
you
see you
so
again
much.
as always.
Appreciate
it.
Put
Thank
that
you.
link on IndyStyle.tv.
Thank you.
You need that follow-up appointment.
Yep.
We'll be right back.